All right, we'll give it just a minute or two longer before and start right on the hour. So give us just a couple seconds here. All right, we're right on the hour, so we'll go ahead and get started in order to conserve as much time as possible. Welcome, everybody. We appreciate you being here today. My name's Casey Shakespeare. I'm the Executive Director of the Rural Health Association of Utah. Very excited to partner today with the Utah Department of Health and Human Services and Four Corners Community Behavioral Health to bring this presentation to you, which is titled Suicide Data and Prevention Facts. This is a very critical topic, and we're excited for the number of people who have registered today. We have a very full session and excited to bring this content to you today. I'm going to pass over to Mark Watterson, who is the Office Director of the Office of Primary Care and Rural Health, and Mark is going to do introductions.
Oh, thank you, Casey. Maybe just a quick housekeeping item.
Oh,
we do plan on having a number of people that are joining today, so please make sure that you're muted throughout the meeting. We'll have opportunities for Q&A at the end. Casey, anything else that you wanted to add?
Yeah, sorry, forgot to mention, CEU is available for today. There's 1 credit hour available for this seminar. You must participate in the polls and stay to the end to get credit. So there'll be polls that pop up throughout the webinar. When those come up, just make sure that you answer. It does record your name and sends us notification that you responded. And then when we get to the end of the presentation, we'll provide a QR code where you can go in and claim your credits. If you have any questions or any issues with getting your credits, you can contact me at info@rao.org and we'll make sure you're taken care of.
Great. Thanks, Casey. Mm-hmm. So to get started, I'll go ahead and maybe one other housekeeping item. If there are questions that come up, please put those in the chat. We're going to have a separate document that we're capturing all those. With time that we have available at the end, we'll try and make sure that our panel has an opportunity to try and answer those questions. But for those questions that aren't answered during this time that we have together, we'll try and make sure that we have our panelists weigh in afterwards, and we'll send those responses back to everyone afterwards. So I'll go ahead and get started then. We want to welcome our panelists. So we have Jonathan Argyle, who is the Violence and Injury Prevention Program epidemiologist for the state of Utah within DHHS, or the Department of Health and Human Services. We also have Joel Johnson, who also works with the Violence and Injury Prevention Program as their information specialist. We have Amanda McIntosh, who is the Suicide Prevention Liaison for Four Corners. Spit that one out. Sorry about that. Community Behavioral Health. And then lastly, we have Carol Rudell, who is the Office of Substance Use and Mental Health Program Administrator, also with DHHS. So for the agenda, we're going to have Jonathan and Joel, who will start out by overviewing some important suicide data in Utah's rural communities. We'll have some CEU questions that we'll ask right after that. Then we'll turn the time over to Amanda and Carol, who will speak about resources available to you all and for those that live in rural Utah on how to prevent suicides in our rural communities. Amanda will also share some of her lived experience that she has with suicide prevention and share why this topic is so important to her and to her community. So with that, I will turn the time over to Jonathan and Joel to go ahead and give us an overview of the urban and rural Utah suicide data that we have.
Thank you, Mark. I'll go ahead and share my screen here. Okay. All right, as I was introduced, my name is Jonathan Argyle, and I work as a suicide prevention epidemiologist with the Violence and Injury Prevention Program at the Utah Department of Health and Human Services. So in my role, I analyze suicide-related data with the intent to inform evidence-based prevention. Suicide is a big issue, as we stated, and a particular issue in rural Utah. But the intent of looking at this data, although it can be heavy and a little sobering at times, the intent is to really inform prevention. And I know a lot of prevention is already going on, and Carol can speak a lot to that. But the hope is that we can continue making data-driven decisions to inform our prevention efforts. So like was mentioned, the intent of my presentation is to highlight some of those some of the key suicide statistics, particularly in rural Utah. But hopefully we can think and bridge this data into prevention, because suicide truly is preventable, and we can work and collaborate together to prevent these deaths. So I'm going to start by throwing out a few statistics more broadly for Utah. So first, Utah had the 7th highest age-adjusted suicide rate in the United States in 2023. And this is fairly consistent year to year, that it's in the top, typically in the top 10, but definitely in the higher rates in the United States year by year. Also, a lot of the states in the Intermountain West tend to have those higher rates. Also, an important statistic, suicide was the 2nd leading cause of death for Utahns aged 10 to 44 years in 2023. So particularly among youth, this is a leading cause of death, and important to address. It impacts all ages and all different groups. Important to recognize with youth that it's one of those leading causes of death. And then wanted to highlight, on average, nearly 2 Utahns die by suicide, and 14 are treated for self-inflicted injuries every day. So this also helps to paint the picture of, while suicide deaths are a big issue and they have a big impact, that suicide is a complex issue, and we also have to address those non-fatal suicide attempts captured in that ED emergency department visit data, with the 14 treated for self-inflicted injuries every day. And then more broadly, suicide ideation and mental health. My focus will be mainly on suicide death data, but important to acknowledge kind of the sweeping impact and the complexity of suicide. Okay, so I wanted to start by showing this map. This map visualizes the age-adjusted rates for suicide deaths per 100,000 population by county in Utah from 2014 to 2023. So just glancing at this right away, if you're at all familiar with the landscape of Utah, you can tell that those practically all of those dark blue colored counties are more rural counties, right? And with the highest being in Duchesne, Garfield, and Juab counties, which are very rural counties. So you can quickly visualize here a little bit of a disparity in the rates of suicide between rural and urban areas. So the next visualizations I'm going to highlight are derived from a report that we recently published in the Violence Injury Prevention Program, specific on suicide in rural counties in Utah. So this visual looks at the rate of suicide deaths per 100,000, comparing urban and rural counties from 2014 to 2023. You can see that year over year, there's consistently a higher rate in rural counties, and an increase from 2022 to 2023, with the rate of 26 per 100,000 being the highest rate in rural counties in this year range in the last 10 years. So an important issue, and important to understand and acknowledge this disparity in suicide deaths. Then when we look at this broken down by age group, this is the rate of suicide deaths by age group, comparing rural and urban counties from 2021 to 2023. Again, across all age groups, rural counties experience a higher rate of suicide death. Just to point out, you can see the starkest difference in rates in the 25 to 34 age group between rural and urban areas. And then the highest rate in both urban and rural areas in the 45 to 54 age group. You also kind of see that starker divide in the older age group as well in rural areas. But across all age groups, we see a higher rate in rural counties. So before I jump into dissecting this data, I want to give some context. So this data comes from a very comprehensive data system that I work in called the National Violent Death Reporting System. And this system pulls data from multiple sources on violent deaths, including medical examiner reports, law enforcement, toxicology, to really paint a wider picture, a broader picture of suicide deaths. And the main bread and butter of the system is that it really looks into the data that can answer the why behind these deaths and provides more contextual information behind them, ideally to help inform our prevention efforts. And so the main variables that we collect in this are what we call circumstance variables. So this visual on the left visualizes the percentage of suicide circumstances in rural and urban counties from 2019 to 2021. So that, for example, on the first one is a recent crisis. So that would be in urban areas, there are 66% of suicide decedents who were deemed to have had a recent crisis, which is defined as a crisis within the past 2 weeks that contributed to their death. So just a couple notes from this. Common suicide circumstances included a recent crisis, current mental health problem, and a history of suicidal thoughts. So those are the top 3 most commonly endorsed suicide circumstances. And then you can see on most of these, urban and rural are fairly similar in the proportion, but those who died by suicide in rural areas were more likely to have a physical health problem contribute to their death. This is in large part driven by a generally older demographic that lives in rural areas, which would make that more likely to be a circumstance. So just want to touch on this data. We collect far more circumstance variables than this. These are kind of the most common and most pertinent to suicide deaths. But hopefully it can be helpful as we try to better recognize the context behind these deaths. More than half had some kind of crisis that precipitated their death, and many were involved with mental health issues. Many were receiving treatment. Many were diagnosed with a mental health issue, and many had a history of suicide thoughts. So just wanted to highlight a couple circumstance-related information on that. So anyone that works in this suicide space knows that they can't get around the issue of firearms when we talk about suicide death. So I just wanted to elevate this message and this statistic here, that firearms were used by 63% of those who died by suicide in rural areas, and roughly 54% of those who died by suicide in urban areas. So clear difference here with those in rural counties more likely to use a firearm as the method for their suicide death. And we know that firearms are very lethal. There's very little time and space for intervention when we use a firearm. In my role, I stratify the data into all kinds of different groups, looking in compare groups, looking for disparities. And practically every time that the population was more likely to use a firearm, they were also the population with a higher rate of suicide death. So very important to consider this issue and consider ways that we can work together to help with safe storage and ways to address this disparity. And part of that I wanted to illustrate with this data that I think is very important and informative information that we get from the National Violent Death Reporting System. So again, I want to first kind of contextualize this data because it can be a little tricky to wrap your mind around. So in the system, we look at cases as to whether, if it was a firearm related death, we look at whether the gun was stored locked or not locked, and then also if it was stored loaded or unloaded, kind of on a separate plane there, a separate variables collected. And this is not available for all, this information wasn't available for all cases. It's a proportion of them. So the percentage here is those where we had that information available on gun storage. So on the left there, you see these two pie charts. The first is the proportion that had it locked versus not locked. So 33% had their gun locked. So the majority, 2/3, had their gun not locked. And then the same proportion, and again, I should note that this is in rural counties. And then the same proportion, you can see the 67% stored their gun loaded. So ideally, we want to push that and more to store locked and unloaded for safe storage. And then on the right, this data is kind of derived from taking these two variables and kind of cross-tabulating them and looking at them in connection with each other. So among suicide deaths with firearm storage information, 87% did not store their firearms safely. So that's defined as the ideal, right? So they had it locked and stored unloaded, right? So 87, the vast majority did not have both those boxes checked, right? Which to me just screams further opportunity to work with these individuals and encourage, educate and distribute gun locks and whatever we can do to lower that percentage and get more that are storing safely. And then another way to look at it, nearly half, 47%, had their guns not locked and stored loaded. So kind of the worst case scenario that we'd want to see was almost half of those suicide decedents in rural areas had their guns stored loaded and not locked. So kind of heavy data, but I think for me, this is hopeful because we have this information and we can leverage it to inform our evidence-based prevention efforts. Again, a lot of which is already going on and has shown impacts in these populations, but we just want to further that work and continue to save lives and prevent a lot of these very preventable deaths. So that was what I wanted to share. I'll turn the time over now to Joel.
Thank you, Jonathan. I'm going to try and pull my slides up here real quick. As mentioned, my name is Joel Johnson. I am the communications manager for the Violence and Injury Prevention Program with the Utah Department of Health and Human Services. Jonathan is our expert in this, and what I do is help take the data that he pulls and creates fact sheets and reports and tells the story. And so we will be providing information, access to our website, so you can see some of these reports in full. And also, I'm coming from as somebody that has 15 years of rural healthcare administrative experience. I was in Star Valley, Wyoming, and rural is near and dear to my heart. So seeing these statistics in Utah is really an eye-opener to me. I realize that rural community members are very close. They know each other very, very well, but they're also very wary to discuss some of their problems or ask for support or help. And so as being a healthcare administrator, it was really about building trust and educating on services that were available, and that asking for help is not a sign of weakness. We worked directly. We had a High Country Behavioral Health, which is a full service line of behavioral health services in our community. Also, as the hospital, we had a counselor on staff. We were also, we were not a part of the Intermountain Health group, but we were working with them with some of their telehealth services. And when I left, one of the things that we were working on was bringing in their telehealth, behavioral health as a service line to help out. Some of the numbers that I wanted to highlight that Jonathan showed was and from some of the things that we've learned through the violence and injury prevention program is if you can reach out and connect with the youth to begin with, you can really help to decrease future negative experiences. Work on that primary prevention. And so connection and support is very key, whether it be at home, school, work, religious communities, or just in the community as possible. One of the documents that we have on our website is called Transforming Communities Through the Youth Connectedness. And through the SHARP survey, which students take, 71% of high school youth frequently were able to talk to an adult in their family or another caring adult. So 70% is a good number, but we would really like to see that number increase, because if they're able to talk to an adult, they might be able to direct them to help. They might catch some of the warning signs that come up. We've also learned that the social isolation is very high in 10th grade students. And so as they're making that transition from middle school to high school to being an adult, that 12th grade year is very, very important. Youth groups in Utah who reported the desire for more connection included multiracial, female, those who identified as Hispanic or Latino, and the LGBT plus community. This is the cover of the Transforming Communities Through Youth Connectedness. VIPP is also working on an educational campaign called Together Utah. This campaign is created to bring Utahns together and strengthen our communities, reduce loneliness and boost self-esteem, create support for times in need, decrease illness, and increase life expectancy. And studies have proven that when we're healthier and happier, when we connect with other people, and by having connection, that really, again, helps to provide a network where people feel safe and willing to talk, and hopefully reduce the suicide ideation. As Jonathan mentioned, several of these suicide circumstances really come down to having a strong foundation of support and being able to interact with problems. When you have a recent crisis, when you're having current mental health, intimate partner problem, physical health problem, death of a family member or friend, or suicide of a family member or friend. Those are all situations that really tax your mental fortitude. And if we're able to set a strong foundation to help people with that, have services in the communities, which is very difficult to do, it can help reduce the suicide ideations and so forth. As Jonathan talked about, firearms, we know that the Second Amendment rights are a very sensitive issue. We ran a campaign about 2 years ago on firearm safety, and the messaging focused on supporting proper storage and use of firearms. You know, we want people, if they would like to have a firearm, we know that they're going to have a firearm, but we'd like them to help store them safely and store them correctly to keep the family safe and access to those that may be having some suicidal ideation. So we'll share the information on our website. Carol is also going to talk about some fantastic resources that are available. But just to let you know that we are watching the data, we have this available for the public and for you all as well, and we'll get the contact information for those resources. Thank you.
All right, we're going to open up the first of our poll questions. So there's going to be 2 questions that pop up. I'm going to give it about 30 to 45 seconds per question. Just a reminder, if you're seeking CEU credits, we need to make sure that you answer the poll questions. So first one's launching right now. Let me know if you can see that okay. All right, votes are starting to come in. And for those of you that are watching the recording, if the question's not showing up, the question is, what is the suicide rate per 100,000 people in rural Utah? And the options are 18.6 out of per 100,000, 20 or 26 per 100,000, 14 per 100,000, or 34 per 100,000. Oh, Kelly, I'm not sure how to make the question pop up for you. You just want to put your, if you can't see the,
I don't know how to answer.
yeah, I'm not sure why the question's not popping up for everybody.
So Casey, at least for me, there was like a little pop-up thing that showed up on my screen that said that there was a poll available, and I had to click on that, and then it popped up.
Okay. Yeah, I don't know if that's not still there. I'm not sure how to make that come back up. The only option I have on my end is to end the poll.
If you click the grid of dots on the lower right of the screen, it'll pop up a thing that offers you polls, and then you click on polls, and then it should show up.
Thank you, Suzanne.
Most welcome.
I got it.
Okay, I'm gonna let this run a little bit longer so that those of you that it didn't pop up initially, you have a chance to go in and answer there. So we'll give it another 30 seconds. And can you all see the results of the poll? Okay.
Yeah, Casey, there should be 2 questions, or
There'll be one more. So I'll end this one and pop up the next one.
okay, thanks.
Mm-hmm. It looks like most people have had a chance to vote here. So I'm going to go ahead and end this poll. But the answer to this poll question is B. It's 26 per 100,000. Okay, I'm going to pop open the next one. So among suicides in rural areas that involve firearms, the majority of firearms were stored unloaded and unlocked. And this is a true or false question. All right, we're at 30 seconds. We're just a last call for any votes. Looks like we're at about the same number of votes as the previous question. The answer to this question is false. So I'm going to go ahead and end that. Jolene, can you click on the grid of 9 dots and see if it's available there for you to answer real quick? That should show the poll there. Okay. Okay, yeah, Suzanne, if you scroll down, it'll show the second one. I'm going to go ahead and leave this one open while we move on to the next presentation, and I'll close it in a few minutes after everybody's had a chance to find it.
Great, thank you, Casey. So we'll go ahead and now turn the time over to, I'll first want to thank Jonathan and Joel for their presentations on the data that we have available to us here in the state. And certainly highlights that there is definitely a rural-urban disparity that we unfortunately have going on. I'll now turn the time over to Amanda and Carol to discuss their lived experiences and also how we can access important resources to reduce the risk in our communities.
Hello, everybody. Thank you so much for having me. It's a pleasure to see you all today and join together in a common goal, which is bringing hope to places like rural Utah for suicide prevention efforts. And I don't have a presentation so much as just my lived experience and my story. So hopefully my words will create a vision for you of what it's like to live as a survivor of suicide loss in rural Utah. My journey with suicide prevention actually began on the evening of July 21st, 2014, where I witnessed my husband end his life. And in his in his wake, left myself and my then 16-month-old daughter, Abigail, to make sense of this world of being a survivor of suicide loss. And living in Price, Utah, there were not many resources to turn to. There wasn't a prevalence of the MCOT services or support groups surrounding survivors of suicide loss, because it was still very taboo and stigmatized to talk about. About a year into my healing journey, I came across the Hope Squad of Carbon, Emory, and Grand County, which is our local community-based suicide prevention coalition, not to be confused with the state's Hope for Utah Hope Squad, but it's parallel in its peer-to-peer presentation of suicide prevention resources, and got really involved with that in about 2015. And that coalition was run under our local health department, the Southeast Utah Health Department, and Debbie Marvadakis. So I started becoming involved in that and learning all that I could about suicide and the genetic components and the history of suicide in Utah and in rural Utah, and learned that because I had lost my husband and my daughter had lost her dad, we were automatically at a higher risk of ending our lives simply because my husband died by suicide. And when you factor in that my husband's mom also died by suicide, it really created this urgency within me to be proactive for myself and for my daughter, who are going to continue living in this lifestyle. And so I started volunteering with the Hope Squad and helped them put together events and messaging around suicide prevention in Carbon, Emory, and Grand. And then there was a special legislative session held in 2018 where Carbon, Emory, and Grand were leading the state in suicide deaths per capita. And at that time, the Southeast Utah Health Department was only receiving about 2% of the state's overall budget for suicide prevention, which didn't lend to any number of FTE that could be working in suicide full time. So Karen Dolan, who is the CEO of Four Corners Community Behavioral Health, and Debbie Marvadakis from the health department rallied for funding to be allocated to our area specifically for suicide prevention efforts as well as opioid prevention efforts. And with that came a position that opened at the health department for a suicide prevention specialist and an opioid prevention specialist. So professionally, I've been working in suicide prevention since October of 2018. Since that time, there has been a lot of movement by way of suicide prevention and messaging and partnerships and sponsorships, and a lot of collaborative effort with our state and the Live On Utah campaign to really focus in on how we are losing people in our area for suicide, what the risk factors are, what are protective factors that we can focus on, what prevention strategies, starting with our youth into our seniors, where were we missing the mark? And in December of 2024, I was given the opportunity to leave the health department and come and work for our local mental health authority. So I'm proud to work for Four Corners Community Behavioral Health, where our crisis receiving center is held, where our MCOT team is dispatched, and work very closely with those departments to make sure that across the board in all three counties, we have a similar message of hope. Hope is my favorite word. I'm wearing it on my shirt today. Living in rural Utah as a survivor, I have a renewed faith in hope that together, collaboratively, we can work toward ending suicide and having zero suicide be our goal. My daughter is now 12 to almost 12 and a half, and she has recently expressed suicidal ideations and self-harming behaviors. And so taking all of this education and experience that I have and applying it firsthand, it brings a different perspective of where our gaps are, where our barriers are, and especially for our youth demographic, and where we can focus and rally more. And the grant that I work in for Four Corners just so happens to be the Garrett Lee Smith grant, which focuses on that youth suicide prevention aspect. Under that grant, I have a number of objectives that I attempt to rein in every day. First and foremost is just increasing that community readiness by promoting and implementing evidence-based suicide prevention programs, strategies, and policies. And we do that in a number of ways. We have created a multitude of media campaigns, partnering with the Live On campaign. We were able to do a coal miner specific campaign where we are trying to destigmatize talking about mental health. Before I can even get into means restriction, before I can get into gun safety and things like that, there has to be a conversation held and a openness to invite the conversation for men's mental health. That is where our demographic lies more times than not. And so it's really breaking down those barriers of starting a conversation, and that it's okay as a male living in a very industrious and physical landscape with coal mining and agriculture and rodeo and things like that, that it's okay to have feelings. It's okay to start that conversation, and who in our community is available to have those conversations, because we all know that suicide is everybody's business. And so everybody should have a baseline of talking about suicide prevention and recognizing those warning signs. So with those media campaigns, we try really hard to normalize men talking to men talking to other people about their conversations. During COVID, we did a huge push for to push out the American Foundation for Suicide Prevention's Real Convo campaign, where we are matching faces and names of people who have gone through a suicide prevention training such as QPR, that they are a safe and open space to talk to. And so we highlighted people in our communities in Carbon, Emory, and Grand that are more than willing to have these conversations with people. We also do, yearly campaigns around beating the winter blues, so that we are promoting, self-help seeking behaviors and coping mechanisms, and really having people tune into how they are feeling so that they can help others, right? It's that whole old airplane adage where you put your face mask on first and then you can help others. So we want to make sure that our community that is helping others in crisis are healthy too. So we focus on the beating the winter blues. I'm also charged with putting on a myriad of events in different ways and trying to get different demographics involved in this conversation. So over the years, we have partnered with the American Foundation for Suicide Prevention. I currently sit on the board of the Utah chapter, and we promote a walk every year, an Out of the Darkness walk. And that is for survivors and people who have attempted and survived, for the families, for friends, for loved ones, anyone in that realm that has ever felt, hopeless. And going to one of these walks really reignites that there is a community within a community here, and that they're not alone. We also put on special events that are geared toward specific demographics, such as we did a Spill the Tea event with our cosmetologists last year, because so many times our cosmetologists, whether it be our hairdresser or our nail techs, are the front line of hearing the despair and desperation and trauma that our community members face on the daily. And so to have them know what resources to turn to and the warning signs to look for was really important in dealing with that. We also did a combos with coal miners, a joint partnership with the Utah State University Cannery department, where we talked about what the geographical landscape and coal mining and mental health look like in Carbon and Emory specifically, and how we can be better equipped to help that demographic of our community members. We, before legislation, delegated money to our first responders for peer support. We launched a peer support fundraiser for our community members, for our first responders and law enforcement and Carbon, Emory, and Grand, so that we could kick off that account for them. We've also done a number of things with the Live On grant that we were afforded through gun locks and gun safes and ammunition lock boxes, medication lock bags, and we distribute those anytime we have a QPR or tabling event. We're giving those out. A couple of years ago, we were approved to have a Live On Utah license plate specifically geared toward our suicide prevention efforts. And to accompany that launch, we created a air freshener that talks about the resources that are available both locally and statewide, so that they could go on and do one of the Live On Utah playbooks, so that they too could be prepared to help others. We have partnered with the Rocky Mountain Elk Foundation. We partner with our law enforcement. We partner with our hospital system to get information directly into the hands of the people that are most at risk for suicide prevention. And when we talk about youth and where we are losing that demographic, it's very hard in our rural communities to have conversations about suicide specifically in our education system, in elementary through high school. And so we have to be a little sneaky in how we deliver that messaging. And so we do that through our Communities That Care Act. We have the CARE Coalition, which is over Carbon County. We have the One Direction and Green River Prevention Coalition for Emory County. And then we have the Great Coalition in Grand County, which covers Moab. And so we work in, the Y-Tri program. We work in Second Step, I might have said that wrong. Good Behavior Games, BOTFIN Life Skills, anything that we can do that builds that resiliency and communication, anti-bullying skills. We push our suicide prevention messaging through that. We have been fortunate enough to sign we have co-sponsored a number of things in our community, specifically through Utah State University Eastern Campus. We have a sponsorship with their athletic department, so that there are banners hung at our soccer field, our baseball field, in our main gym. This coming year, we'll have advertisements on prevention messaging that is being played during basketball games and volleyball games. We also partnered with the Desert Thunder Raceway, which is our dirt track in Carbon County, and we have a car that is wrapped in 988 that also promotes the Live On Utah campaign and all the good work that they're doing, along with our Hope Squad of Carbon and Marin Grand counties. We have partnered with the rodeos that have come through just as recently, and then Carol will touch on this. She's an expert and a genius in her field. But we were able to hang up banners at a couple of our rodeos to show support to that community, where we have lost a number of youth in our rodeo community across the state. A couple of the things that I love most, and if I'm talking too much, shut me up, but a couple of the things that I love most about this work that we do is that connection that is made every time we give a QPR presentation, which is our question, persuade, refer. It's a 2-hour suicide prevention training where you're taught the warning signs, how to question somebody's suicidal ideation, how to persuade them to live, and then to push resources in their direction. That connection that is made because more times than not, you or somebody that you know has lost somebody to suicide. And so it's building this family of support and connection. And through the work that we do with the American Foundation for Suicide Prevention, we're able to push out Healing Conversations program, which is another peer-to-peer survivor resource. We're able to push out Talk Saves Lives. We're able to push out More Than Sad. All of these amazing programs that are directly a result of research that Joel and Jonathan have done that have pushed our target in where we are meeting people. Another part that I love is the advocacy work that is done both at the state level and at the national level. I literally just returned from DC this morning at 2 a.m. I was on the Hill rallying for 2 separate bills to come through our legislation. One is to reauthorize funding for the Lorna Breen Reauthorization Act, where money is given to different grants for healthcare workers to give them resources and help and support, as frontline people in the work that they do and the interactions that they have with our community members. And then the second one was, for our veterans and making sure that there are gun locks and gun safes and things in place for them. So that was a lot to be said. All in all, I love the work that we do. I love working with the state and our community members. It gives me nothing but pleasure. And it also just shows that there is a ripple effect associated with suicide. And now that you have all heard my story, you too are affected by my husband's suicide because I was able to talk to you today. So I hope that if you learn nothing more, it's just to take care of yourself, reach out to your loved ones, check in on everybody, and know that there is hope in suicide prevention.
Thank you, Amanda. You have an amazing story and you share it so well. And I like how you said at the very beginning, your word is hope. And I think you build hope in not just your own personal life, how you share it, but in the work that you do. Amanda has mentioned so many resources that we have in the state, whether those are private organizations or state funded services or whatever. So I'm just gonna share my screen really quick and respect our time, and hopefully I can make this work really quick and just talk about some of the resources and all that are available in our state. We've talked a lot about firearms, and I see a lot of those questions in there, and I am going to talk about our firearm resources. We do have some in Utah that are actually quite effective. So hopefully everyone knows about 988. There's never a wrong time to call 988. If someone's struggling, I think and I'm just going to back up, too often the word crisis, we each define that differently. And I think it's important to recognize that what I might call as a struggle for me might be a crisis to someone else and vice versa. And so just recognize that anytime someone is struggling with their mental health, with substance use, with anything that is challenging their normal day-to-day life, 988 is available to call. And one of the things that recently changed is now, in the past it was based on area codes, and now it is based on your closest cell tower. So if you live in, let's see, Clarkston, Utah, your cell phone might end up being on an Idaho cell tower, or West Wendover, Nevada, those kinds of things. So it does go based on a cell tower. If it's a landline, it will obviously go to the state that you're in. When you call that number, a trained crisis worker answers that call. Their job is to triage and to stabilize the person in crisis. Now, if I'm calling on behalf of someone, they're going to triage me and figure out what does Carol need to help this person. So anybody can call, not just the person who's struggling, but they'll de-escalate a situation and certainly provide resources. And if that's not sufficient in that case, then they'll turn around and Amanda mentioned our mobile crisis outreach teams. We have those statewide, but honestly, we know that in our more rural areas, that mobile crisis outreach team may be an hour or 2 hours away. And so there may be alternatives. Maybe someone stays on the phone, whatever, but we want to be sure that if someone needs someone in person, that that's available as well. Some of our areas also have receiving centers. Amanda mentioned the one in Price as an example. It's just a great place for anyone to go that doesn't need an emergency department, but needs that behavioral health support. And it's just a place where you do have a nurse or someone on staff, but you also have clinicians on staff and folks who can really help, and peer support specialists. For children and families, we also offer service across the state that empowers families to build a stable environment for a child who may be in crisis. We have a warm line, which you can call, again, not quite every time, it's 8 to 11. But what the beauty of that is I can call just because I'm looking for resources. I can call 988 and get resources. I can call a warm line and get resources. Believe it or not, it's the same people answering the phone. So in reality, you're getting all kinds of experts taking those calls. We also have our SafeUT apps. We have 3. If you're not familiar with all 3 of them, most people know the one for education, which is great. It's been around the longest. It allows students, families, parents, teachers, anybody connected to education, K through college, to text and chat confidentially, or even give a tip about someone that they're concerned about. Something similar with our National Guard. I can text anonymously and send a tip. And then we have our first responders. That one is a little more difficult to put a tip behind because we sure have a lot of frontline people in healthcare and all. But the reality is the SafeUT folks can still connect them to resources and services within their communities. And when I say in their communities, I don't mean Wasatch Front. I mean every community in this state, okay? We also have safety planning app. This one in particular, we're always worried about how do I keep myself safe? How do I keep someone else safe? I'm worried about them. Make a plan. That's usually what we say, make a plan. And this one is actually through the Veterans Affairs, the Department of Veterans Affairs, but anyone can use it. You don't have to be a veteran. And I like it because it really has everything in it. My safety plan could be, I need to call my brother when I'm upset, or I need to bake some cookies, or I need to go for a walk, whatever, my way to be safe. I can put it in and it just prompts me, which is a great way. Because when I'm in crisis and I'm struggling, I'm probably not thinking as clearly. But if I know it's in my app, I can just quickly look it up and be reminded. It's just a great opportunity. Oftentimes we wonder how I can help someone find a therapist. I always say start with their insurance, but I know right now my own insurance, if I go down it, a lot of people aren't taking new patients, so it can be difficult. But we do have local mental health authorities in each of these regions of the state. I hope you're familiar with your local mental health authority. As Amanda said, she works at Four Corners Counseling right there in Price, but it serves Grand, Emery, and Carbon counties. So all 3 counties are served by the Four Corners Counseling Center. We also have Intermountain Health. We know they're all over the state. They aren't providing all services in rural areas, of course, but they do offer a service to everyone, literally everyone. If I am looking for support for behavioral health, I can call this number and they will walk me through. Oh, well, what's your insurance? Okay, let's go look up the state insurance. Okay, where do you live? How can we find you? They will literally walk you through how to find behavioral health services in your community, whether you have insurance or not. And that's the beauty of this, is it's just an opportunity for all of us to be able to access that with support, because we know navigating some of these systems is incredibly difficult. There are other resources. Amanda mentioned the American Foundation for Suicide Prevention. They offer so much, and they offer it statewide. NAMI, National Alliance on Mental Illness, again, offers it statewide. So many of the services used to just be in person, probably on the Wasatch Front, right? COVID came along and we said, gee, we need to do something different. And now so much more is being offered virtually. And I would also say that we're more comfortable participating virtually. And I think that's helped people feel like they can reach out as well. Firearm safety, without a question, that's something we need to be aware of. We have gun locks. I have a whole room of gun locks. If you need gun locks, let me know. You can also get them from your local mental health authority and your local health department. Intermountain Healthcare has them at all of their clinics as an example. We work together on that one. Safes are available. We have mobile crisis outreach teams that when they go out and visit someone in their home or their business or wherever it is, they'll ask, do you have an unsecured firearm? If they do, the chances are your mobile crisis outreach team will actually hand them a safe in that moment so that they can take care of that firearm and be sure it's secured and that everyone in that family is safe. I'm going to keep going. Medication disposal bags. Definitely, there's take back drug days, those kinds of things. But we also have medication disposal bags available if anybody needs those. In terms of after a suicide, you know, in the field, we always say good postvention is suicide prevention, because the more we can help families deal with their grief and figure out how to remember hope about that loved one's life, rather than just dwelling on the pain and the grief that they're experiencing. We have a lot of resources. Caring Connections is one. They offer resource and bereavement groups for a variety of reasons, not just suicide. It could be just loss, I did not mean just, but loss of a spouse or a partner, or loss of a child, a loss to suicide, loss to substance use. They actually bring people together for 8-week groups to figure out that grief. We also have the Sharing Place, which focuses on children and families. And while it's not very rural, they do have one opening in St. George very soon. Really excited about that. They do such a great job. They've been around for like 35 years, helping children and families deal with grief, for any grief, loss of a parent in a car accident, could be anything. But they do it so well that one of the reasons they're starting in St. George is because they literally had a family driving up from St. George every 2 weeks to attend groups with their children. So they're really trying to grow and expand. Intermountain Health offers support groups in almost every clinic that they have around the state. Now, those are grief groups. They're not necessarily specific to suicide, but again, it's that opportunity for people to address the grief that they're struggling with themselves. There are certainly trainings available. Amanda mentioned a whole bunch of them, but you can get them through local health departments, mental health authorities, local coalitions, American Foundation for Suicide Prevention. You can call us. We have contacts in all of the counties across the state, and help you hook up for trainings. But I would also say that on liveonutah.org, we do have a lot of resources, and I hope you'll take some time to explore that. We have it in both English and Spanish as websites. And then we have playbooks. These are 8 to 10 short lessons, roughly 6 minutes a piece. And each of those lessons address things like, how do I help someone? What is my role in suicide prevention? How do I check in? How do I ask them if they're thinking about suicide? And oh my gosh, if they say yes, what are the resources I need? So we have it in English, Spanish, and a military version, because our military folks bring a very different experience than those of us who haven't served. So we actually have 3 of them, and you can complete those online as well. All of these resources that I've just talked about, I have as a document. I'm going to share it with Casey, and be sure everyone has it. It's something front and back. You can print and make copies for yourself and have those available in your work. Thank you.
Thank you, Carol. And I just put up the next poll question. If you can go ahead and answer that. And while you guys are answering that, we're going to start on our Q&A session. So Mark, I'll turn the time over to you, and I'll run those polls. I'm going to let this one go for about a minute, and then I'll open the last poll.
Yeah, and with the time that we have available, and wanting to make sure, Casey, that people are able to obtain that CEU credit, I think what we might do is we've captured all of the questions that were asked. I know people had really great questions about, substance use and whether we're capturing that data, and also, around firearms and access, and whether this is more of a, a causal or contributing factor. So we are absolutely going to answer those questions. We're going to put all that into a document and make sure that that is sent out to everyone. But in this interest of time, Casey, let's focus on making sure that we get the CEU stuff completed.
Yeah. And then just a little plug as well as we're wrapping up, the Rural Health Association of Utah does have our annual conference November 12th and 13th in St. George. We have pre-conference workshops, breakouts, keynotes, so networking, social, even live music this year. So this is a great opportunity if you're looking for more CEU credits. The applications are pending for the CEU and CME, but we have 9 credit hours for ACHE, and we expect in that range for the CEU offerings as well. So you can go to rao.org/conferences to get more information and register. And then here is the QR code. Go ahead and scan this, complete the form, and then we'll verify and send you your certificates for today. So we'll leave that up for the rest of the hour. And please make sure, if you haven't already, that you complete the polls before you exit. There's 2 polls open right now. And then once you've completed those polls and scanned that QR code, we appreciate you being here today. And if you have any questions, let us know.
I can't scan. Is there an alternative?
Yes. I'm going to put the email again, info@row.org. If you just email that email, request the code, we'll send that over to you. And that's in the chat box.
Thanks, Casey. So just to be clear, individuals have two ways that they could complete this form, right? For those that have access to a cell phone and can go ahead and scan this, that form should pop up on their phone. And then you just posted an email address in the chat so that for those who don't have access maybe to scan a QR code, they can email you and you will send them the link directly.
Correct. Yep.
Okay. Again, just wanted to thank everybody for joining today. This is a very important topic and something that, we were really happy for the opportunity that we've had as the State Office of Rural Health to be able to partner with and work with the Rural Association of Utah, Rural Health Association of Utah, with our Office of Substance Use and Mental Health, and also our Violence and Injury Prevention Program. I think it highlights the fact that, it's just a few of the groups that are working on this really crucial issue here in our rural communities and really throughout the state. So again, thank you for your time that you've set aside to be here today. We will absolutely be following up with the slides and with resources and links and the answers to your questions. So thanks, everybody.
Mm-hmm.